Really big thing that patients need to understand about click and pop is that it's not curable. Can you hear that? The pain, on the other hand, is something that we can take care of. Hey guys, welcome back to Dr. Thalia-Rae. If you're looking for a place to get entertaining, sometimes sassy, but always honest dental advice, please subscribe below. Today we are going to be talking about TMJ. First, what is TMJ? I'm sorry to burst your bubble, but everybody has TMJ. TMJ is actually short for the temporomandibular joint, which are the bilateral jaw joints that help you open and shut your mouth. The correct term for somebody who's having dysfunction in their jaw joint is actually TMD or TMJD. So from here on out, I'm just going to call it TMD. Like many other joints in your body, the TMJ is described as a ball and socket joint. In reality, the TMJ is a ganglioarthrodial joint, which means that it can both rotate and slide. It's one of the very few joints in your body that can do this, and this is part of the reason that it causes so many problems. In addition, the TMJ has a movable articular disc or meniscus in between the ball and the socket of the joint. On top of that, there are four muscles called the muscles of mastication that either attach directly to the joint or into the articular disc or the meniscus on top of the joint that influence the way that the joint moves and how it functions. But that's not all. There are also nerves with equally crazy names running all around the temporomandibular joint. You might be thinking to yourself, this sounds like a lot. Well, it is. Correct diagnosis of temporomandibular disorder will often take multiple visits with different types of doctors and dentists to properly determine what the cause of your temporomandibular joint dysfunction actually is. Today we are going to discuss the number one reason why patients will report to their dentist for a temporomandibular joint issue: noise. Why does my jaw joint pop? I'm assuming that many of you have already gone to a dentist or doctor who's told you that you have TMD, and I just want to clear something up and let you know that if your jaw clicks and pops, that doesn't necessarily mean that there's something wrong with you. Research done by the NIH and the American Association of Oral and Maxillofacial Surgeons has indicated that an asymptomatic or painless click and pop in your jaw is common in as much to 25% of the population. That's 1 in 4 people. And if your jaw does click and pop, the vast majority of the time, estimated to be as much as 85% of the time, following some very simple instructions can make sure that you stay out of pain and don't develop problems with your joint later on in life. Remember how I talked about the articular disc or the movable meniscus that sits on top of the temporomandibular joint? And I'm sorry, I'm geeking out so much right now because I think this is so interesting. That meniscus moves or changes morphology as your jaw joint moves, and sometimes it can get stuck in the wrong position. If that disc or meniscus gets caught in front of your jaw joint, your bone has to move backwards, back into its original position, popping over the disc in order for you to close your mouth. This can also happen when you're opening your mouth. Now again, you don't need to freak out. The vast majority of patients with this problem have an asymptomatic or painless click or pop of the jaw. If it doesn't hurt you, and if it doesn't prevent your jaw from moving, there's honestly not a problem. That doesn't mean that you might not have a serious issue. If your articular disc or meniscus is positioned forward or anteriorly too often, the trauma of your jaw joint popping over the disc to get you to close or open your jaw appropriately does create micro trauma over time that can lead to inflammation and pain in the joint and become an issue later on in your life. So now that you understand a little bit of what TMD is, what are the most common things that your dentist or doctor is going to tell you to do to deal with this chronic click and pop? The answer is really simple. You have to learn how to relax. The problem with the temporomandibular joint is that we use our mouths all the time. Basically, we never stop running our mouths. If you have TMD, you are going to have to stop talking forever. I'm totally joking. I'm totally joking. You're basically just going to have to decreasing function on the joint. That includes eating chewy foods, eating hard foods. Cut out things like chewing gum and chewing ice. Another thing that your dentist or doctor will recommend that you do is to avoid moving your mouth to extremes. You probably shouldn't be doing that. Oh, so Dr. Thalia-Rae, that's it? Just relax my jaw joint? A good amount of my patients feel like they also need pharmaceutical management for their TMD or drugs. The dentist or doctor may sometimes recommend pharmacological therapy or a prescription. This will be a prescription for an NSAID or an anti-inflammatory medication like ibuprofen. These medications deal with pain if you take them occasionally, but if you take them steadily, they also deal with inflammation or the swelling that's going on in your jaw joint and causing a lot of pain. Another thing that your dentist might recommend you do if you have a click or pop in your jaw is place warm compresses on this area of your jaw for about 15 minutes a day and then massage the muscles in that area just to help them relax. Finally, your dentist or doctor might also recommend that you take a muscle relaxant. A muscle relaxant basically takes somebody who has a muscular reason for why their jaw joint is out of place and relaxes those muscles to allow the jaw joint to go back. Personally, I don't like giving muscle relaxants to my TMD patients unless they're further along and have failed some of these more conservative treatments, because the muscle relaxants have a lot of side effects. The thing that everyone needs to understand is that the click and pop of your jaw is not curable. It might come and go for the rest of your life. The pain, on the other hand, is something that we can take care of. I actually have a click or pop on my right jaw joint. Can you hear that? I noticed myself developing it in college when I had finals or major exams coming up. And so for the past decade or so, I have, modified my behavior. I'll do soft diet, I'll massage my jaw joint or have somebody handsome do it for me, minimize how much I'm talking, believe it or not. Basically, all of the instructions I just gave you, I follow myself to help minimize the click and pop and to make sure that it doesn't cause any pain. Okay, so that concludes our novice discussion of TMD, specifically the clicking and popping in your jaw joint. I hope it's been informative and you understand what TMD is, what causes the click and pop, some things you can do to minimize it and to not freak out. If I didn't answer your question, don't despair. I will be posting the second part of the video on chronic temporomandibular joint disorder, which is basically when the things that we talked about today don't work. It's a much more serious discussion, and when it's done, there'll be a link right up here for you, so check back in. Make sure you leave a comment below to let me know what you would like me to talk about next, or to ask any questions you might have about TMJ, TMD. And again, thanks for visiting my channel, Dr. Thalia-Rae. I will see you guys later. TMJ is the gangliomoarthrodial joint. I got it though, I think I got it. It's attached to... Are people going to be okay with the word?